everybody. This is Gary. Um, Today is Friday, August 13th, 2021. It's early in the morning where I am. I'm in Rochester, New York, in the United States. It's 3:25 a.m. This is just an update to my schizophrenia and the surgery I had on my bladder on Monday. Um, some background on the story. I had surgery on August 9th, 2021 on my bladder because I had inability to urinate, also known as urinary retention. Um, the surgery was to remove what's called diverticuli. I think that's how it's pronounced, off of my bladder. What that basically means is my urinary bladder was stretched out with things that look like water balloons. The weak wall of my bladder and the muscles stretched out and retained fluid. There was about 3 of these balloons that had been removed during surgery, um, and then the urinary bladder wall was resealed. The surgery was performed, at least in part, by a robot. Obviously, the surgeon is the one who guided the robot. Um, I have 5 rather painful incisions in my abdomen where the robot arms went into my abdominal wall, through my abdominal cavity, down into my bladder where the surgery was actually performed. Um, this is the second surgery I've had in the past 4 months in an attempt to treat surgically my urinary retention. The last surgery I had was, I believe, back in May on my prostate. Um, they reduced the amount of my prostate through surgery that surrounds my urethra. Um, the idea being that I do have, or had, an enlarged prostate that was blocking my urine flow. But even after that surgery, I was still having some urinary retention. So I decided to go ahead and get what's called the cystogram, where they examine my bladder with a camera, and they found the diverticuli, the water balloons, on the wall of my bladder, and we decided to remove those in an attempt to strengthen my urinary bladder muscle wall so I could urinate again. I'm still wearing a urinary catheter with a urinary leg bag. Um, it's too soon to tell if the surgery was successful in its goal. I've been wearing a urinary catheter into my bladder for the past 4 or 5 months. I'm getting a little tired of wearing it. It puts a lot of stress on me mentally and physically. Um, I'm in considerable physical pain right now from the surgery. My whole abdomen hurts. Um, and they gave me narcotic painkillers, but only enough to last a few days because there's an opioid crisis, and obviously doctors don't want to give out too many narcotics. And I'm not sure I wanted to take any more narcotics anyways. I took them for the first couple of days after surgery. They only gave me tablets, 5 milligram tablets of oxycodone. I was allowed to take one every 4 to 5 hours. I believe it was, and I ran out just a couple of days after surgery. The only thing I have to manage the pain right now is regular strength, or actually extra strength Tylenol, no narcotics. So the pain is pretty intense. If it gets any worse, I'll go to the emergency room and see if they can do anything about it. Um, but I had the surgery on Monday, spent 24 hours in the hospital where they kept an eye on me. When I had my prostate surgery, the surgery was only um, in and out kind of thing. I was discharged as soon as I recovered from the anesthesia from the hospital, so I didn't spend the night in the hospital. Um, so I have a cystogram scheduled for next week where they'll put a camera into my bladder to see how well I healed after surgery. Then the next step after that is setting up an appointment for possibly removing the catheter, the urinary catheter, out of my bladder permanently. What they'll do is they'll remove the catheter, put saline solution into my bladder, and if I can urinate that solution out a few minutes after it's put in, then that means I can urinate again and I don't have to wear the catheter anymore. But we don't know that yet. If the surgery didn't work, then I'm going to have to do what's called self-catheterization indefinitely. And what that is instead of a permanent or semi-permanent urinary catheter that I'm wearing all the time, I will be given long plastic tubes that are called straight catheters. And up to 3 or 4 times a day, I will have to empty my own bladder by inserting the catheter into me. The catheters are disposable, they can't be reused because of the possibility of urinary tract infections, and I will have to self-catheterize or straight cath, as it's called, indefinitely, possibly for the rest of my life. If it's not my bladder or my prostate that was causing the problem, then it's a possibility that it's my psychiatric meds that are interfering with my ability to urinate, and I can't go off my psychiatric meds. We've already reduced them a great deal. I was taking 1,000 milligrams of Seroquel every night. Now I'm only taking 600. We reduced a couple of my other medications. I'm still on Klonopin for now, at least, to deal with the stress of the surgery. And I'm still on my other psychiatric medications, the Neurontin for anxiety, Zyprexa for breakthrough psychosis, when I start to hear voices, or hear them worse, because I'm always hearing voices anyways. I did go to the psychiatric emergency room yesterday morning, which was Thursday, today's Friday. Um, I woke up in a great deal of physical pain. Actually, I was up all night from Wednesday to Thursday. I couldn't sleep. Um, Around 7 o'clock in the morning, I just broke down crying. Not just from the physical pain, but from all the frustration, and my voices got worse, my paranoia got worse. Um, I was by myself and I just broke down crying, so I called for an ambulance. Um, I was suicidal, I was psychotic. Um, so I didn't want to do anything stupid, so I called an ambulance, went to the psychiatric emergency room. They evaluated me, they gave me some Klonopin to calm me down, and then they sent me home. By the time I got home last night, it was around 7 p.m. So I spent about 12 hours in the psychiatric emergency room. Just because of my overall symptoms of schizophrenia, hallucinations, depression, anxiety, insomnia, feeling suicidal, had all gotten really bad over the past few days. And I needed to be seen by someone. A psychiatrist happened to be at the emergency room just before I was discharged, because as a psychiatric resident, he's on call to work at the psychiatric emergency room whenever he's needed. So he was there. He didn't come there specifically to see me. We only talked for a few seconds. We discussed that for now we're going to continue the Klonopin just to help deal with the stress of my going through surgery. Of course, Klonopin doesn't do anything to help alleviate physical pain, um, but at this point, it's helpful when dealing with stress. Klonopin is obviously an addictive drug. This is not a permanent solution to my stress. It's just something I'm using now to deal with my catheter and my surgery. Eventually, he will probably take me off the Klonopin. Um, yeah, so that's pretty much the update I have. Uh, Not much else going on. It's very early in the morning. I really can't sleep. I did fall asleep about 7:30 last night. It's 3:36 a.m. right now, Eastern Standard Time in the United States. My next appointment with my psychiatrist is on August 26, 2021. Um, I have a few upcoming medical appointments too as well. Um, I've been better. I still kind of feel like shit and I have a lot to do. Um, I have to pick up my medication. My apartment hasn't been cleaned in days. Um, I have to go food shopping. I have a lot to do just to keep up with my daily activities of living, as they're called. Um, Keeping up my personal hygiene, showering, take my meds, go for walks for exercise. My doctor did say that it's not good for my physical pain to be too sedentary. I'm lying down while I'm doing this video right now. My doctor wants me to exercise more by walking outside. The weather's been fairly nice in Rochester, New York. It's been fairly warm, not a lot of rain, so it's easier to get outside and exercise. Um, Not much else going on. Like, share, subscribe, comment. Um, I would like more people to see these kinds of videos, so if you could do me a favor and like my videos, that helps with the YouTube algorithm to getting my videos out to other people. Um, I will keep trying to make more videos. I haven't made videos in months. It's only been in the past week or so that I started making videos again. I'm doing this as a live stream right now, but obviously anybody can watch it after that as well. Um, I did quit smoking about 4 weeks ago. Today's Friday. As of Saturday, tomorrow, it'll be a full 4 weeks since I had a cigarette. And I went from smoking 2 packs a day to none because I was getting scared about dying from smoking related diseases like lung problems and heart disease, emphysema, cancer, that kind of thing. Um, I'm using a lot of nicotine lozenges to get through this. Right now, I'm just worried about not having cigarettes. I'll worry about the nicotine addiction later. Right now, I just don't want to be smoking cigarettes. Like, share, comment, subscribe, um, and just like this video.